Okay, something new here. That's interesting. YouTube is putting up something new here. There seems to be something about game. Let me know if you know about that. Welcome to the live. Okay, I really like to know if I'm audible. Okay, welcome to the live. Let me know as soon as you are able to join in. Let's know where you are watching from. Do let me know if you can hear me clearly and if you can see me. I need to know. To go. Welcome everyone joining in. Very pleasant evening from this side. Please let me know where you are watching from. Thank you for joining in. Let's get to know you. Let's get to meet you. Welcome to the live. Welcome. Please introduce yourself. Let's get to know you. I'm Dr. Soyemi. Welcome to my live streaming live from Lagos, Nigeria. Please let me know where you are watching from. Thank you for joining the live. I'm happy to have you here. Everyone joining in. Welcome, welcome, welcome. Please remember to like this live, share with somebody in your world. I'm sure they will be glad to be part of this, not just being a part of this session, to be a part of this healthy community. When it comes to health, that's one thing we are passionate about here. When I say a community, I mean not just myself. We have quite a number of people from different parts of the world who are committed to health, health related matters, talking about exercising, talking about mental health, talking about relationship and how that affects your health. So I want to welcome you once again. If you are coming across the channel, my channel for the first time, I want to say I'm glad to have you here. Please double tap on the screen or look for the three dots and click on those three dots. You see the options for subscribing to the channel. You will also notice the thumbs up. You get to have the opportunity to click on that to also show your support for this channel. I've been on YouTube for about 4 years. I've been practicing as a medical doctor for more than 10 years. And interestingly, I'm passionate about individual health, family health, and how your environment affects your health generally. And according to the World Health Organization, if you have been part of these live sessions, I like to quote that definition again and again, and that's to bring emphasis to the fact that your health isn't just about your physical, the physical part of you. There is a mental side, there is a social side, and of course, there's a spiritual dimension to your life, to your health. Okay, so the World Health Organization defines health as a state of complete physical, mental, and social well being, not merely the absence of disease or infirmity. That's a very powerful definition. I'm going to say it again. The World Health Organization defines health as a state of complete physical, mental, and social well being, not merely the absence of disease or infirmity. Okay, so if you are going to declare yourself as being healthy, you're not going to just say, oh, I have no pain in my body. The question I want to ask you is that how healthy are your relationships? Are they solid? Are they positive? Are they productive? Are they helping you mentally? You know, uh, are they growing? Those are questions that I really like to know. If your relationships are not helping you to be productive, then you may not be having the right kind of health that you deserve. Okay, so we are looking at a very important topic at this time, and I say important because it's a global burden. Hypertension is a global burden. By the way, let me know where you are joining from. Let me take a pause there and let me know where you are joining from. If you are coming across the channel for the first time, then please introduce yourself. Are you watching from Nigeria? Are you in the United States? Are you in Belgium, Portugal, Brazil, Kenya, Uganda? Are you watching from the UK, Switzerland? Let me know where you're watching from. Are you from South Africa? Okay, so we like to know where each and everyone is watching from. And remember to double tap on your screen. When you double tap on your device, it doesn't cost you money. Okay, it's just a kind of support for this channel and especially for this live session. All right, so please, if you know someone that is dealing with high blood pressure, that has a diagnosis of hypertension, that is being managed for hypertension, maybe it's a long-term management or a recent diagnosis, then you need to share this live link with them. All right, so it's very important that we all are conscious of our health, especially this holiday period. There is a tendency for individuals, even families, to ignore or neglect or forget the fact that people need to still monitor things like the blood pressure, things like the blood sugar, and other things that need to be checked regularly, vital signs basically. All right, so if you know that there's a burden, the burden is not just an individual's burden. It's not just about a family burden. It is not a community burden. It is not a state burden. It is not just a national burden. It is a burden of global impacts. You know, we're talking about the burden of hypertension. So let me know in the chat where you are watching from. I like to meet with you. So I'll just wait a bit more to see who and who is here so that we can get into this topic for this session. We're talking about high blood pressure and blood pressure medications. This promises to be informative and interesting. And if you have any question, please you can drop in the chat. I'd like to take your questions. Let me know if you are dealing with hypertension or you know someone that is. Interestingly, there are people that have even had some complications, developed complications from hypertension. All right, let me take a sip here. Okay, I think we are moving in gradually. Thank you for the likes. Well appreciated. Let me know who and who have given their support in 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 terms of the like thumbs up. Thank you so much. Please introduce yourself. I'd like to give you a shout out as we move on into this important discussion. The burden of hypertension cannot be overemphasized. It's something, it's a condition that's affecting, a chronic medical condition affecting billions of people all over the world, you know, and it's not just affecting the individual's quality of life, also affects their own contribution, their impact, the impact they should have in families. Okay, I need to reduce this. Okay. So with this, I know that I'm audible. I'm checking another device. Audible, and I think my video is good. Let me know in the chat if you are okay with the video and the audio. So if you know anyone who is dealing with hypertension, a family, a friend, a colleague, please share this video session link with them. I'm sure they will appreciate it. They will appreciate it. So on a live session some days ago, I actually discussed the burden of hypertension and what the burden is like in Nigeria. And it's actually a fact that 1 in 3 adults has high blood pressure. That's a staggering fact. It is heart touching. And we look at many cases of heart attack. We talk about cardiac arrest, people just slumping and dying. These are things that are usually uh, occurrences related to high blood pressure, poorly managed high blood pressure or hypertension. Now, do you know that there is actually a difference between high blood pressure and hypertension? Of course, people use those terms interchangeably. I, an individual can have high blood pressure, but not necessarily be termed as hypertensive. So I'm going to explain that. There can be a brief or momentary elevation of an individual's blood pressure and just recovers from that, gets back to normal, while another individual or same individual can later have recurrent readings of high or elevated blood pressure. And if this is sustained, persisting, and sometimes symptoms already setting in, complications showing up, that individual may have a diagnosis of hypertension by a qualified medical doctor. Okay. And having a diagnosis of hypertension is not a life, it's not a death sentence. Okay. It's not a life defining thing per se, even though we say that the management is a lifetime management. But interestingly, most people should not actually die from hypertension. People may die with hypertension. There's a difference between dying from hypertension. Dying from hypertension means that the individual develops some complications such as stroke, a heart attack, kidney failure, and the individual just passes on. But an individual that has a good, proper management of his or her blood pressure can grow into old age and not die from complications of hypertension, but may pass from just old age setting in. Okay? So that's why I said there's a difference between dying from hypertension or dying with hypertension. So an individual can have good management of their blood pressure, even if they were diagnosed 20 years ago, they can still live more years, additional 20, 40, 60, depending on the time of diagnosis and how well they are able to manage themselves. So this is very important. And I am saying this to encourage someone out there, if you have a recent diagnosis of hypertension, it isn't a death sentence, and you should not see it as a death sentence. It's not something that should bring anxiety or depression even to you. So if you know anyone that is dealing with this, it may not even be yourself, you need to give support as much as possible. So why this burden? The burden is so much because there are many people, many adults out there that have high blood pressure that have not been diagnosed. And that is because not many people are checking, not many people are doing the necessary checkup. So thank you for the emojis, thank you for the likes, thank you for joining in. If you are just joining in, please let me know where you are watching from. Let me know who is here. So we take some little pauses to to see how more people can benefit from the introductory aspects of this discussion. Okay, so let me know if you can hear me loud and clear. Please put in the chat loud and clear. Please double tap on your screen to like the live. Everyone joining in, please double tap on your screen to like the live. And then let me know where you're watching from. Let's get to meet you. Okay, so there's a sticker there. Something you can't believe is real. Okay, interestingly, there are people that don't believe about anything about high blood pressure, hypertension, you know. And the fact that you don't believe that something exists doesn't mean that it doesn't exist. Okay, so I am a Christian medical doctor and I believe in God, in the power of God to heal, and I have seen God heal. I mean, patients have recovered at different times, you know, with or without medications. Okay, but the fact is that the science has proven the existence of high blood pressure. There's something called diagnosis of hypertension, and there are ways by which this can be managed. And in previous live sessions, I really emphasized the aspect of diet, dietary modifications, what you can avoid to prevent or to even manage hypertension, the aspect of exercising, what you need to be doing, the kind of activities that you need to ensure that your blood pressure is under control. And then the aspect of avoiding stress, the aspect of avoiding alcohol, and then cigarette smoking should be avoided. Okay, so these are areas that we looked at in previous live session where I actually emphasized the fact that many adults all over the world, including Nigeria, are developing high blood pressure. And so, but there are natural ways by which this condition can be managed. And that applies to everyone. Even if you don't have a diagnosis of hypertension, you are healthy, you need to be eating healthily, you need to be eating the right kind of foods, avoiding the wrong kind of diet, you need to avoid alcohol, avoid smoking, you need to be exercising, you need to be moving, making movements, you need to increase your activity in such a way that it helps in lowering your blood pressure. Do you know that movements, physical activity, exercise can actually lower your blood pressure by about 10 millimeters of mercury? And even avoidance of stress, ensuring that you get adequate sleep can also help to reduce lower your blood pressure. So that's why sometimes individuals who are also on medications may be wondering, oh, so my blood pressure can become this low when they combine use of their medications with these lifestyle changes. The lifestyle changes, the dietary changes are constant. However, the fact is that your doctor may decide that you need medications according to the guidelines, according to the assessment, according to your evaluation. Your doctor will decide the need, will recommend appropriately the need for medications, the type of medications that you need. And so when you need to take medications, please do. There are quite a number of people who have a diagnosis of hypertension. They have been placed on medications, but they refuse to take medications. Now, do not forget that I believe in lifestyle changes. I believe in dietary modifications to help in that's part of healthy living and to help in management of hypertension. All right. But there are a number of people that still need to be on medications. And it's those medications, or it may just be one medication, and some most cases more than one medication to help to get proper control of their blood pressure. So lowering of blood pressure isn't just about one thing. It's not just about doing one thing. It's not just one drug. It's not about one herbal medicine, that some people may think, even though there are certain herbs that have been found to be useful, okay? A use of the hibiscus flower, talking about zobo leaves. If you are here in Nigeria and or what zobo leaves is the hibiscus flower. When cooked without added sugars, can add some fruits, and that has been proven to be helpful in lowering high blood pressure. Also, ginger, garlic, they have been found to be good, but this should not be used in isolation, especially if your doctor has placed you on medications. They should not be used in isolation. There's something called intensive lifestyle modification, and that means that if you have a recent diagnosis of high blood pressure, you may be asked, based on the assessment, the judgment, the evaluation of your doctor or your physician, you may be asked to get into this lifestyle habits. You need to exercise regularly, do your 30 minutes brisk walking every day, most at least 5 days, and then you can also modify your diet such that you are using the healthy plates. That means you are taking 50% of fruits and vegetables in every meal. You are taking 25% of protein. You are making your starch or carbohydrates about 25%, and reducing unhealthy fat, avoiding unhealthy fat. So these are things that can be done and should be done. In fact, during these holidays, there's a tendency, and I mentioned in the previous live session, that dirty December means people throw caution to the wind. Let's eat, let's party. There's nothing wrong in partying. There's nothing wrong in enjoying life, okay? But we must do this with some caution. We must do this with a consciousness of the fact that there are results that we get to see from what we allow in, what we eat, what we drink, what we don't eat, what we don't drink, what we do, what we don't do. All right. So enjoy this season, but make sure you are checking, monitoring your health. Okay. Make the right choices. Fruits are still available. Vegetables are still available even this period. You have a choice. You can make your choice. Now, okay, have some fruits here. Here. I will not be able to touch everything here now, but I'm telling you practically that there are things that you can do regularly, choices that you can make, decisions that you can make, a life of discipline and healthy lifestyle that you can actually live by to ensure that you are living that healthy life, that complete person that you need to have to benefit not just yourself, not just your family, not just your community, but the global world, the world at large. There's an impact you need to make, and your life needs to be in the right shape to do this. Okay, so when was the last time you had your blood pressure checked? Let me know in the chat. When was the last time you had your blood pressure checked? Thank you, everyone who is just joining in. If you are just joining in, I want to welcome you. Let me know if you can hear me. Let me know if you can see me clearly. Let me know how this information I'm sharing is helping you. Please remember to give this live session a like. Just double tap on your screen. Hope my mic is still good. I hope my mic is still good. Yes, it's still on. Okay, but I need to know if you can hear me from your side. Please drop a comment in the chat. Let me know if you can hear me. Okay. By the way, if you are coming across the channel for the first time, please do well to give your support, subscribe to the channel. We've got a lot to learn together. All right. So we'll be looking at some blood pressure medications. Now, if an individual refuses to do anything about their blood pressure, what can happen? Many things, different things can happen. One, can recover miraculously, get in shape, and they're fine. Um, some people are not able to achieve that spiritually. Some are able to do that. Others may have to combine the use of their faith with the use of medications. And of course, I've emphasized the aspect of lifestyle changes. Very important. Okay. I want to appreciate you for subscribing. Thank you for subscribing. Thank you. Let me know who it is. Okay, because I'm checking the background here, the back end. I can see people joining in at different times, and it's a pleasure to have you joining the community. To have you join in the community. Thank you, thank you, and thank you. Welcome once again, everyone joining in. All right, so uh, I know we are in different time zones, and this may affect who and who is here. You know, if you are a night person like myself, you will still be awake at this time in Nigeria or some other African countries. Of course, if you are in the UK, you may also be awake at this time. The US, some people are in the day, afternoon, and all. So people are still active. So I don't know where you're watching from and what time it is in your location. I like to I like to know. Okay, welcome back. Okay, please confirm that you can still hear me. Am I audible? Welcome or welcome back. If you have been here or if you're just joining in, let's get to meet you. Let's get to know you. All right, so we'll be diving into, I've given some introduction to blood pressure, high blood pressure. High blood pressure is dangerous. Low blood pressure, hypotension is dangerous. All right. So how do we get blood pressure to be within the normal range of for the systolic? I did a short earlier today on what the measurements are like. You can say it's high when it's above 140 for the systolic, and it's low, too low, when it's less than 90 for the systolic blood pressure. While for the diastolic, that's the lower reading, it's said to be low when it is less than 60 millimeters of mercury, while said to be high when it's greater than 80, we use 90 millimeters of mercury. All right, so anything above 140 over 90 millimeters of mercury is said to be elevated blood pressure. Now, the diagnosis of hypertension itself should be made by your doctor, and your doctor knows what to check for to determine that you need to be on proper management, not just on preventive management. Okay, so if you have ever been placed on medication, you probably have been placed on any of these medications I've been talking about. And by the way, disclaimer, I'm a medical doctor, though I'm not here to specifically give you prescriptions or tell you what to take, what not to take. I'm giving a general information on blood pressure medications. I'll be talking about what they do, giving some examples, and then some side effects that may be associated with some of these medications. Let's go. Now we have diuretics. Diuretics, some you can call them water pills. They are pills that can be used to lower blood pressure. Now, especially it's a common one used here on this side in Africa, in the blacks, even black Americans. They help the body to actually remove water, excess water, and salt. So that way, because water and salt, especially sodium salt, have been implicated in hypertension. So whatever it is that can help, including the fact that in blacks have higher tendency to retain salt and of course water. So it is beneficial for black patients, beneficial for people with heart failure. People with heart failure may have symptoms like facial puffiness, swelling, pedal swelling, breathlessness. They may have cough that is productive of whitish sputum. But the diagnosis of that needs to be made by a medical doctor. So it's usually a first line medication for people with such diagnosis, and of course with some other medications for support. So heart failure itself is a complication. All right. So common side effects: individuals who use diuretics, for example, hydrochlorothiazide, furosemide. This, if you have heard that before, if you have that as part of your medications, let me know in the chat. Okay, these are people who may have the tendency to actually urinate frequently. Okay, so, and of course, for some of these medications, they have side effects such as they can cause dizziness because of that change, the loss of fluid, changes in the electrolytes, and this is something that you may need to communicate with your doctor about if you notice you're having unbearable side effects. Okay, so very important. That's talking about diuretics. So preferably your doctor may say use it in the morning rather than use it at night because of the frequent urination that may occur. So it can be a common cause of sleep disturbance. If you're on antihypertensive and you're wondering why you are not sleeping, your doctor will ask you, okay, what medications are you taking? when are you taking these medications. If diuretics are part of what you are on, then the doctor may make necessary adjustments in terms of the timing, whether you to use during the day preferably, and then in the morning preferably, and then probably reduce the dose and probably uh, make some other recommendations for you. Next, let's talk about AC inhibitors. These are angiotensin converting enzyme inhibitors. Let me not bore you with grammar. They help to relax the blood vessels. They actually block the hormone that is raised that causes elevation of blood pressure. So such uh, medications include lisinopril, if you have heard that before, enalapril, ramipril, and these are medications that are good for people who are diabetic, people who have also have heart failure, people who have had a previous heart attack, you know. But common side effects of using ACE inhibitor, one very common one, some patients have come in, I've seen patients who are presented with a cough, but as a doctor, because of the knowledge of the fact that individuals who are being on, some people may even be recent, some long-term use of lisinopril, especially AC inhibitor, can cause cough, and that cough is usually dry. Okay, so that's why your doctor may ask questions. If you're having a cough and you're also hypertensive, are you on lisinopril? The doctor may want to actually change this medication. Other side effects of lisinopril include dizziness, may raise your potassium levels. All right. Next are angiotensin receptor blockers, talking about ARBs. What they do is that they are actually similar to the ACE inhibitors, but they do not produce cough usually. Examples of this include losartan, temesartan, valsartan. Okay, but these are actually good for patients who are not able to tolerate the ACE inhibitors. They are also good for patients who are dealing with diabetes, patients who have a kidney disease condition will also benefit. But common side effects also include dizziness, may produce hyperkalemia. All right. Next, let's look at calcium channel blockers. Let me know if you can hear me in the chat. Let me know if you can see me, if you can hear me as we move on in this very important discussion for people who are hypertensive and those who are not but have relatives or friends, colleagues who are dealing with hypertension. Okay, I know you are there, but let me know who it is and where you're watching from. And if you have any question, please drop in the chat. All right, so next are calcium channel blockers, CCBs. These help to relax the blood vessels. The blood vessels, those are the vessels that carry blood, of course, and then the pressure that the flow exerts on the walls is what is measured. And then if it is higher than the numbers that we have talked about, then we talk about high blood pressure. So what the calcium channel blockers do is that they help to block the calcium that enters in that may affect the function of these blood vessels. So they relax the blood vessels. So examples include amlodipine, nifedipine, very common, diltiazem. These are common medications for blood pressure. They are preferable for also for black patients, patients who are elderly, also good for patients who have angina, that's chest pain. Okay, what are the common side effects of calcium channel blockers? They may Patients using this may develop some swellings in their ankle, yes, and then their legs. Patients may complain of headache. You know, if you are on an nifedipine or amlodipine and you are having frequent headache, the headache may be from hypertension itself, if it is not well controlled, may be from other things, but your doctor will want to actually rule out that side effect and probably withdraw that medication for some time or replace it so that that can be confirmed. So headache, flushing can also occur with calcium channel blockers. Now, beta blockers are not uh, commonly like before, but selective beta blockers very important. What they do is that they slow the heart and reduce its workload, especially for patients who are having tachycardia, fast heartbeat, and then people who are also anxious, people who can hear their heart beating, palpitations, you know, people having some other heart disease conditions. So metoprolol, bisoprolol, atenolol are commonly used. Okay, there are examples of beta blockers. Now, what are the side effects of these medications? Fatigue. Individual may actually have sexual dysfunction. You know, some people complain of low performance while on antihypertensive. So this may be one cause of it. All right. Next are alpha blockers. These are also medications that act directly on the blood vessels. They block the tightening of the signals so that the blood vessels can relax. Better used for patients who have, especially men who have high blood pressure, men who are also dealing with prostate disease. Okay, example of this include prazosin, doxazocin. These are common medications that you may find in men and then who are hypertensive, who are also dealing with prostate disease. Common side effects of this medications, talking about alpha blockers, include dizziness, um, orthostatic hypotension can occur, dizziness, while standing, weakness. These are side effects that may occur with alpha blockers. Next are centrally acting drugs. These actually act directly on the brain. They reduce the brain signals that raise blood pressure. Examples are methyl dopa, preferable in patients who are pregnant, in pregnancy, who are also hypertensive, clonidine. These are also good for resistant hypertension. All right, common side effects of this include drowsiness, dry mouth. You know, these are things that may occur in patients having using centrally acting drugs. Those are some classes of antihypertensive that you need to know. So let me know which one you are taking. Are you on any of this? And have you experienced any side effects before any of this? I need to mention one uncommon one, lisinopril use. You know, I saw a video recently a doctor was talking about uh, the use of the 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 effect of swelling. You know, some people have lip swelling from the use, and that kind of reaction or effect individual needs to present to the hospital as soon as possible. As soon as possible. Yes, it is rare, but a serious complication or side effects. That's angioedema, where there is swelling of the lips, and then the face. All right. Some people may be wondering why my doctor say I should use more than one drug medication for blood pressure. Sometimes it has been found out that control is better when individuals are on two or more medications. All right, many people will actually benefit from this because of the different causes of hypertension, and your doctor will want to address these different causes. So one drug may not be enough. So combinations such as AC inhibitor plus diuretic may be used, ARB plus calcium channel blocker may be used. So you need to note this, that if you are being placed on medications, you need to be regular with your medications. We've seen patients who have skipped medication for a day, 2 days, a week, and then developed some serious complications, and which has never left them the same. Okay, so we need to be careful. Side effects may vary. You know that an individual has a side effect of using a particular medication does not mean that you are also going to develop that side effect. Okay, so you need to be careful how you interpret, how you avoid. If you need to discuss, please discuss with your doctor to get appropriate information, to be well informed about your medications, the side effects, and why you're being placed on what. So never stop your blood pressure medications suddenly, except you develop a side effect that is unpleasant, very disturbing, that you need to see your doctor immediately. But the risk of developing complications such as stroke, a heart attack, they are there. Now you need to note this importantly. So people have questions like, can I stop taking my drugs because now my blood pressure is well controlled? Let that decision be taken by your doctor, because if your blood pressure is within normal range while you are taking your medications, that simply means is that your medications are working. Okay, so take note of that, and don't forget that lifestyle changes plus medications will yield great results. Okay, there are sexual side effects, and these are manageable. People have concerns. I've seen men especially talking about how they are not able to perform well. So, but your doctor will evaluate you. May be related to your medications, may be related to some other conditions. So, I believe that you have gained some insight into blood pressure and the blood pressure medications. So, if you have any question, please share. Let me get to know in the chat, and let me see how much response or clarification I can give to you on this platform. All right. I want to appreciate everyone who joined in. Thank you for joining in. I hope it's not that YouTube, the system isn't showing some of the messages, okay? Well, sometimes that may happen. So the choice of the medication to be used isn't something that you should do yourself, because your doctor has better information and will guide you appropriately. So follow your doctor's guidance, and then I'm sure you will be fine. So many things are considered, different factors are considered when it comes to the use or the choice of medications, and your doctor will let you know appropriately, including race, including lifestyle, other comorbid factors, if you're overweight, if you have a kidney challenge, if you have diabetes, these are other conditions that may determine what your doctor will prescribe for you. So please talk to your doctor. Talk to your doctor. So if you are watching the replay, then you can subscribe to the channel if you are yet to subscribe for more information like this. And if you are watching live and you're yet to subscribe, please do well to subscribe. And I'm sure I'll get to see you, connect better with you um, through different means, like in a post, and engage with my post in the community. You can respond to the shorts, then the live long form videos. Okay, so thank you. I wish you great health. I mean, better health as we move into 2026. All right, so keep keeping fit and stay healthy.